Right, folks are still joining, but we'll just give it 1 or 2 more minutes. Okay. All right, well, welcome everyone to the webinar today hosted by the Center for Health, Work and Environment. Today we will be providing vaccine guidance for frontline or all workers. It will be a 1-hour presentation. All participants will be kept on mute throughout the duration of the presentation. We ask that you use the chat function for any technical issues. My colleague Brenda Thompson and I will be monitoring that. If you have any questions for our panelists, please enter them in the Q&A box. Our moderator will be able to access that, and we'll have a Q&A portion at the end of the program. I just want to let everyone know that this webinar is being recorded, and you will be sent a link to the recording in your follow-up email. We also ask that you take a survey at the end of this webinar to help us know how we're doing. We love the feedback. And through that survey, you will also be able to access a certificate of attendance for today's program. So before we get going, I would like to introduce our moderator, Dr. Lee Newman. He's a distinguished professor at the Colorado School of Public Health. He is the founding director of the Center for Health, Work and Environment, a NIOSH Mountain and Plains Education and Research Center, and one of 6 National Centers of Excellence for Total Worker Health. Dr. Newman is also a professor of medicine in the Division of Pulmonary Sciences and Critical Care Medicine at the University of Colorado Anschutz Medical Campus. Over the past year, Dr. Newman has led consultation, research, and interventions for government agencies, businesses, labor groups, public health, and community organizations on pandemic response.
Thank you very much, Courtney. It's a pleasure to be with you all here today. We have a fantastic panel and lineup to discuss what's I know is front of mind for many of us. As somebody who, among the other things that I'm doing, is I'm going out on weekends and volunteering as a vaccinator at clinics. I'm getting very much in touch with the frontline experience and getting a lot of calls from organizations asking, how do we interpret the guidance that's come out? What can we be doing to better promote vaccine use? And there's no group that's more important for us, I think, today than frontline workers, our people who have been our champions throughout this pandemic. And so I'm really excited to have our speakers here today to join us. We're going to start off with a presentation by Captain Delaney. I'll introduce everybody here in just a second. We're then going to have a panel discussion around some of these issues of the vaccine and use of vaccines in these very special, important workforces. And we're going to have some time for question and answer from you in the audience. So let me start by doing some quick introductions. Captain Lisa Delaney is with the National Institute for Occupational Safety and Health, NIOSH. She's been there since 1999 and is currently serving as Associate Director for Emergency Preparedness and Response at NIOSH, where she leads NIOSH's response planning and preparedness activities. She has a distinction of having responded to nearly every major domestic emergency, beginning with September 11th attacks, and has served on multiple COVID pandemic response roles, including the NIOSH team lead in the CDC's Emergency Operations Center for the first 7 months of the response, and then as Senior Advisor and Strategist to the NIOSH team, now as the Essential Worker team lead as on the Vaccine Task Force. We're delighted to have Chief Paul Payson here with us. Chief Payson was appointed Denver Chief of Police in July of 2018. He has served the department and the residents of Denver going back to 1995, and we thank you for your service. He's overseen the creation and/or the expansion of innovative programs with a public health focus, including the Domestic Violence Prevention Program, Law Enforcement Assisted Diversion, Mental Health Clinician Co-Responders, support team assisted response, the STAR program. Yeah, I could go on and on. Chief Payson has overseen and updated the recommendations of a progressive use of force policy, which I think we're all very aware of, especially in these times. He has provided additional training and resources to his officers and expanded the department's resiliency and wellness programs, which is germane to our topic today, since the COVID response should be thought of as part of what we need to be doing for the health and well-being of our force. And thirdly, we have Dr. Elisa Koval. Dr. Koval is a division head of the occupational medicine program at Denver Health, past president of the Rocky Mountain Academy of Occupational Environmental Medicine, and currently is part of the American College of Occupational Environmental Medicine House of Delegates. She also serves, importantly, on the board of directors of Building Warriors, which is a nonprofit organization dedicated to mental health of first responders. I think that it's worth noting that she's also a member of the annual physicals committee for the First Responder Center of Excellence. So it's a great panel coming from law enforcement, coming from our federal response team, and coming from the medical community as well. So thank you all for being here today. We're going to start off with Captain Delaney giving us a brief presentation, and then we're going to cut right into our panel discussion. So with that, Captain Delaney, let me turn it to you.
Great. Thank you, Dr. Newman. Give me 1 second to share my screen. This is always the scary part, to see if this will actually work. Hold on just a minute. It's not wanting me to.
It's always the challenging part, isn't it?
Well, it's not wanting to let me go down to the bottom, but you know what? Now it is. So there we go. Is that working?
There you go.
Can you see?
Yep.
Wonderful. Okay. Well, first I'd like to say thank you to the Colorado School of Public Health for hosting this wonderful webinar and giving us an opportunity to share some of our knowledge and work that we've been doing. So thank you, and we have a very robust schedule. I'm going to jump right in. As of yesterday, CDC is reporting over 286 million doses of COVID vaccine administered. 49% of the population has received at least one dose, and 39% of the population has received, is fully vaccinated. This information that's on this slide is taken from our CDC COVID data tracker website. And for those of you who love data, I highly encourage you to go to our website to get this information. They really carve out the data from vaccinations to cases, hospitalizations, deaths, in every which way that you might want to look at it. So I encourage you to visit, and I'll add the link to that website in the chat function during the slide, or after I finish this presentation. To the left, you see the breakdown of the 3 vaccines that are currently approved under emergency use authorization. And to the right, you see states related to their adoption of vaccination and number administered. And the darker colors, those states represent more doses administered. So you can sort of see geographically where more people are getting vaccinated. So as I mentioned, currently there are 3 different vaccines that are authorized. 2 of those vaccines, the Pfizer, BioNTech, and Moderna, use the mRNA platform to confer immunity to people, and the Johnson & Johnson Janssen uses a viral vector. All 3 of these vaccines were tested in tens of thousands of adults from diverse backgrounds, including older adults and communities of color, during different time courses and in different areas of the world. They've all been proven effective at preventing serious illness and hospitalization and death. And it is unknown, though, how long the protection from the vaccine might last. I do get that question a lot. These clinical trials just began in the fall. So people haven't even been vaccinated for a full year. So those studies are ongoing, and CDC hasn't really publicly said anything about boosters, but you've seen the pharmaceutical companies discussing whether or not boosters may be needed. And that's based on a potentially waning immunity and also to adapt to circulating variants. So there's more studies to come and data from those studies to help make that determination. So the COVID vaccines currently available are safe and effective. Millions of people in the US have received COVID-19 vaccines under the most intense safety monitoring in US history, and that's really true. I don't think any other vaccine has been studied, scrutinized, analyzed as much as these have been. The vaccines in development are being carefully evaluated in clinical trials and will only be authorized or approved if the benefits outweigh potential risks. And the FDA and CDC will continue to monitor the safety of these vaccines, and getting vaccinated can help protect those around you, especially those at increased risk for severe illness. So sort of some myths about the vaccination, and we recognize that people do have concerns about the vaccines. You know, they were developed rapidly, but no safety steps were skipped in that process. And so, you know, just to sort of tackle some of the concerns that we hear, that the vaccinations do work and they help prevent you from getting sick. If you've had a previous diagnosis of COVID-19, it's still beneficial for you to get vaccinated. So CDC still encourages you to get vaccinated when it's available, and it's really available widely. I used to say this when it's available to you in my spiel in this, but now it's available, so you can go out and get it anytime. The vaccines themselves will not make you sick. They won't make you get COVID. There certainly can be side effects, and those side effects vary by person. You know, in my very technical study of my household, there were varying degrees of side effects. We all got different vaccines, and I think I was on the receiving end of the most side effects, but that was okay. I was really glad to have them and know that I was building up my immune system. Other questions, the COVID-19 vaccines will not cause you to test positive on any of the viral tests because you're not being vaccinated with a live virus, so you're not going to test positive for any viral tests. The vaccines, this is really a remarkable effort by the federal government to get these vaccines manufactured and available and distributed within just a very short time frame, and that's caused some concern for people and thinking that maybe some steps were skipped in that process. But that's not true. The steps were just done sometimes at the same time. So the government made a financial investment in manufacturing these vaccines while those clinical trials were still underway, with the hopes that those vaccines were going to prove effective, because otherwise then they were just going to go down the drain and not be available. So the researchers were using existing networks to conduct the vaccine trials. Like I said, some of them, you know, they were done in different countries at different time points with different circulating strains. So there's quite a variety, a variety of age groups were also part of those trials. So it really, you know, represented the swath of the country. The FDA and CDC did also prioritize the review and authorization. So, you know, those things typically take a while to get the people in the right room together, and those were prioritized. So that happened really quickly too. So for all of those reasons, that's why we were able to have vaccine available in about a year's time from the identification of this new emerging virus. Safety of the vaccines is a top priority. Before authorization, the FDA carefully reviews all of the safety data provided by the pharmaceutical companies and manufacturers. And then CDC's Advisory Committee on Immunization Practices also reviews the safety data before recommending its use. On the back end, once these vaccines are authorized, there's still a number of safety and monitoring activities that are taking place to ensure that we have all the knowledge and all the information to know how people who are vaccinated are being impacted. So we're relying on existing systems. The VAER system, the Vaccine Adverse Event Reporting System, is a system that's been in place for many years that monitors any vaccine adverse events. We've also implemented a new app platform called vSafe that allows people who are vaccinated, you can enroll after you're vaccinated and you report daily your symptoms and side effects. So I encourage all of you to, if you haven't yet been vaccinated when you are, go and sign up for vSafe so that you can share your experiences. One of the important uses of the vSafe monitoring program is for pregnant women. Pregnant women were not part of the clinical trials. And so this information that they're providing as part of the vSafe structure is helping us understand the side effects and experiences of pregnant women who are vaccinated. So of course, I work for NIOSH, and we think that workplace vaccination programs are really important in encouraging and getting workers vaccinated. There's really two ways that this can happen. There can be on-site clinics that are hosted by the company to help make vaccinations really easy to get. I like to tell the story that during the Ebola outbreak, I was team lead for the NIOSH team and the CDC response and working almost every day. And the only reason I got my seasonal influenza vaccine that year was because all I had to do was walk down the hall. My children, I'm embarrassed to admit, did not get their vaccines until January of that year because I simply could not pull them out of school, make the pediatrician's appointment. So they got theirs a little later than I would have liked. So I certainly understand having convenience as a factor for people who to get vaccinated. So if you're considering it, if you're an employer and you're considering a worksite vaccination program, you really need to contact the health department in your jurisdiction to help you implement that program. It's important to understand your workplace vaccination program works best for employers with a large number of workers, that you have space enough to be able to administer it at the clinic and maintain that social distancing. It must be a team effort that includes management, human resources, employees, and labor representatives in that process. Offering the vaccination at no charge to workers and during off work hours will increase success. Often more than one opportunity for vaccination, workers may be hesitant the first cycle, the first time you arrive, and then that they see that their coworkers are getting vaccinated and doing okay. Then that builds that confidence, and they would be willing to get that vaccination on a return of the clinic. We also recommend that you have flexible, non-punitive sick leave options for employees with signs or symptoms after vaccination. It can be really difficult for some employees who fear that the side effects may cause them to miss work, and that's important, especially for some who can't go without a paycheck, and that's important. So that could be a huge motivating factor. But we know that not every business can offer on-site vaccination. And so we still can encourage employers to seek COVID-19 vaccination in their community and provide them with information about where they can get the vaccine. So again, be flexible in your human resource policies, establish policies that allow employees to take paid leave to get the vaccine, and also to take leave if they have any side effects from the vaccine. Use of promotional flyers, to advertise and really support vaccination, that can be displayed in break rooms and cafeterias, and just sort of building that that culture of how important vaccination is to get back to that new normal. Posting articles in company communications such as newsletters or emails can also be a great way to share information and get that information about vaccination to your employees. We've developed a toolkit. We initially called it an essential worker toolkit because we were following the ACIP guidance, which initially prioritized essential workers to receive vaccine, but really it applies to any workplace. This toolkit has lots of great information. I'm a big believer in not reinventing the wheel. I love to beg, borrow, and steal anywhere I can to not have to start at a blank piece of paper. And so this toolkit has great information. It contains key messages about vaccination. We have a slide deck, so there's slides that you could incorporate into presentations. There are frequently asked questions. Again, those posters and flyers that I mentioned that are important to hang in the workplace. Newsletter content, you can adapt that information and put it into your own newsletter. Specific letters to your employees or members, and then social media content if you do that. So the link to that toolkit is on the bottom of the slide here. So we've gotten a lot of questions about vaccination mandates. Because this is an emergency use authorization, people are concerned that maybe you legally couldn't mandate it. CDC recommends that employers encourage vaccination and, again, establish those supportive policies. I think, in some ways mandating a vaccine may backfire on you and not give you those results that you want. It may build mistrust, but the EEOC, the Equal Employment Opportunity Commission, does suggest that employers can mandate COVID-19 vaccination, but that they still must allow for exemptions for certain medical conditions and also for people who have sincerely held religious beliefs. But ultimately, whether an employer requires or mandates COVID-19 vaccination is a matter of state or applicable law. I think there's, at least that I'm aware of, two legal actions right now. So we're seeing this play out in courts, and so that may sort of help employers sort of understand where this one might go in the court of law anyway. CDC has established a Vaccinate with Confidence team within the vaccine task force, and we've worked with them. They've been a really great group to help us understand, how to talk to workers and how to build confidence and overcome vaccine hesitancy. It's a real spectrum. There's folks like me that, as soon as I could get scheduled, I was driving down for mass vaccination clinics to get my shot. But then there's other folks who are really sort of more in that wait and see, I'm not so sure what to do. And so, really being able to talk to them and share concerns, and it's perfectly okay to have questions about the vaccine and want to learn more to help educate, make an educated decision for your own health. There's been lots of studies, the Kaiser family polls about, how people are viewing vaccination, and there's some statistics here on the slide, but factors that really weigh into acceptance are wanting to understand the side effects, how well does it work, is it safe, is there a cost associated with the vaccine? And vaccines are more acceptable if your healthcare team says it is safe. We know that if your healthcare provider talks to you and recommends vaccine, that you're more likely to get vaccinated. If there's no cost associated with it, if you have confidence that can facilitate you getting back to school and work and returning to that new normal that we're all going to experience, and then making it easy to get, are all ways that people can help build and build their confidence in accepting the vaccine. So when we talk about vaccine confidence, it's really having trust in three things: that you really believe in those recommendations or the vaccines, and you understand and believe that the vaccines work, that you trust the providers who are administering the vaccine, and that you trust the processes and policies that led to getting the vaccine. So the development, the licensure, the manufacturing, the recommendations, all of those steps that get that vaccine out and available, that you trust that process. So a new pandemic and a new vaccine and a new adult-focused platform means shifting tactics. Individuals across the spectrum will have concerns, and these concerns are understandable and need to be addressed with empathy and transparency. Concerns about healthcare providers among healthcare providers is a risk for overall vaccine confidence. Really, healthcare providers are those trusted resources in communities. And then each community will have unique experiences that inform their vaccine perceptions. So engagement with community organizations and leaders will expand access to clear and accurate information on COVID-19 vaccines. For some groups, I may not be that trusted community person that they want to hear about how safe vaccines are. They want to hear from their clergy or their union leader or their neighbor. And that's perfectly okay. So I'll have some recommendations later to talk about a little more detail. So these conversations, share your experiences, why you chose to get vaccinated and your experiences getting vaccinated. Engage in conversations. Again, start with that empathy and understanding. It's okay for people to have questions and be concerned. So really listening to people and that are sharing their concerns and addressing misinformation by sharing facts are some ways to overcome vaccine hesitancy. and being prepared for questions. So, I hope that all of you after this presentation can go out and be vaccine advocates and share your experiences and your knowledge. There's a lot of information on the CDC website. So I encourage you to sort of navigate and look for some information that will be helpful for you that you can use. It's at all different levels. Not all of it is super scientific. We have some plain language flyers that are really helpful too. So all of that can be used to help have this important conversations. So this really is an exciting and historic time, but we know that work is far from over. We'll have unanticipated challenges, but we're working closely with you and our partners to find solutions and overcome those obstacles. But fundamentally, vaccines are an important tool to control the pandemic, but we need to continue to message the importance of masks, social distancing, and hand washing, even post-vaccination in some cases. So looking ahead, we're going to continue to monitor and conduct surveillance on the variants. We're going to continue to look at vaccine effectiveness studies. We're expanding vaccine eligible populations. Everyone's available now. We hope to get, it was really exciting that the adolescents over 12 were approved, and studies are ongoing for even younger children. We're continuing to combat hesitancy and focus on vaccine equity and making sure that vaccines are available to anyone who wants them, and that things like transportation, those types of obstacles of not being close enough to a vaccine site will be overcome so that anyone who wants the vaccine will be able to receive it. Again, these are just sort of some recommendations again about protecting yourself and family and getting vaccinated, and how important that is, but I'm going to skip over that in the interest of time. May 13th, CDC issued new recommendations for fully vaccinated persons, and this graphic really sort of breaks down in a pretty simple to follow way the recommendations. So we're really saying that people who are vaccinated are protected. We believe in these vaccines, and as a result, they can they no longer have to wear masks or social distance. Of course, if people choose to, as a personal decision, that's absolutely fine. Here in DeKalb County, where I live in Atlanta, we're all still wearing our masks grocery shopping. I think we just like it and feel comfortable even though we're vaccinated. So those measures are still in place though for people who are unvaccinated. They're still recommend that social distancing and mask wear continue until they're vaccinated. I did want to say a word that we are updating guidance. So February of 2020, one of the first guidance documents that we issued at NIOSH related to general business guidance, and that's been updated several times as we've gained more information and knowledge about the vaccine, or about vaccines and the virus itself. We are incorporating recommendations related to CDC's recently issued fully vaccinated recommendations, and right now it's going through the government bureaucracy of clearance. And so I can't pin down a date on when that's going to be available, but please know that we're working on it and we hope to get out as soon as possible. Here's again information on the COVID website. This is specific to vaccines, but it's a really robust and rich website. I'm sure many of you have visited the website. This cases and data link right here is where that all the data that I mentioned at the beginning of the presentation can be found. So if you really want to mine all of the data, that's a great website to visit. So I think with that, I'll conclude and say thank you and hand it back over to Dr. Newman.
Great, thank you, Captain Delaney. That was a great summary. You packed a lot of information in there, which is a helpful update. And we do have an opportunity for people to submit questions. Please use the Q&A function, and we'll get to your questions here in a few minutes. But what I'd like to do is I'd like to pivot to Chief Payson for a moment, and ask you how this is working for you on the ground. So you've got Denver Police, Frontline, all over the city. How has things gone for your organization in handling vaccination of the force? And how have you instructed your team to work with potentially unvaccinated members of the public?
Well, Lee, thanks for the question. Let me start out by going backwards. And I think Lisa hit on it a couple of times in her presentation as far as how this becomes a trusted vaccine. And I want to give credit to Dr. Koval for all of her help. It actually goes back to the testing process for us. So having that relationship with regards to testing early on in the process then helped us as we encouraged our workforce to get vaccinated. It's not a new face or a new group that is helping us. Now, our agency, and what I would suggest to any agency is to act early. We did a lot of, after overcoming many of the testing challenges that we had, then when there were first the trials, the clinical trials of the vaccine, we participated there. We heard that Moderna was coming to Colorado. We reached out to Dr. Tom Campbell at UC Health to say, hey, we are an at-risk category. We are not sitting at home. We have to respond to calls for service. We come in contact with folks that may be infected all the time. How can we participate in this clinical trial? We did our own research and really looked into messenger RNA because we also didn't want to participate in a trial and then get sick as a result of that. So, some of that early work where myself included participated in the clinical trials back in August of 2020. And then leading up to the approval, the emergency authorization of both Pfizer and Moderna early on, we sent out a notice with that included our union president, a video sharing his experience during the trials as well. And then Denver Health and Dr. Koval really helped us with access to the vaccine. We had special clinics set up for our officers in the safety department that are right across the courtyard from police headquarters, at the Union Hall, at the Sheriff's Department. And so it worked out great. That initial push in late December, early January, we were right about 70% participation. I'm very confident that we are well over 80%, which is something that nationally is pretty good for this type of profession. And then we've just continued to push the message using those trusted folks that have been with us all the way through this process. So that would be, or that's our experience, and then that would be our advice, that having access, having that trusted voice is something that helps to break down those barriers.
That's much appreciated. Dr. Koval, it sounds like you've been involved in that process, and I know you've worked with other groups as well, other organizations. Do you want to add from your perspective? And I'm interested in the kinds of strategies you've used for helping to establish and build the trust as well.
Sure. Well, first of all, thanks for having me, and thank you, Chief Pazin, for the shout out. The partnership that Chief Pazin mentioned cannot be overstated. It's a relationship that has existed between our organization and the City and County of Denver's Department of Safety for a long, long time. And I know in my role, I feel that's a relationship that I was entrusted with when I came on, which was about 5 years ago. So keeping that relationship intact and continuing to build it over time is the foundation of just about everything we've done. The other thing I'll say is, once this whole crisis really got going, which happened rather quickly, and I know it started abroad, in the fall of 2019, but in early 2020, we had to mobilize, and we had to mobilize quickly. So fortunately, we were able to connect with people we already knew, the known entities that Chief Pazin already mentioned, and strategize. For a period of time, we were meeting weekly. with the leaders of the Department of Safety agencies. And that weekly check-in allowed us to make all these plans and put these things into practice as quickly as we possibly could. I will give another huge amount of credit to the crime lab over at DPD, because they gave us a place to be. They gave us a huge room where we could distance. They gave us, whatever resource we needed for our team to come in and set up and meet them where they were at. Coming to where these folks work and where they spend their time was a huge, huge factor. And that was probably the most important strategy up front, was addressing that access piece as aggressively as possible. So that was huge. That was absolutely huge. In addition to that, being in a kind of post-COVID world, we really looked to enhance our educational offerings. We've always done, bits and pieces of that here and there around occupational risks, because obviously, things like the police department, the sheriff's department, the fire department, they have unique occupational risks, and we've done things like that in the past. So it was relatively easy to tap into that and say, okay, we're going to put on, a series of 3 educational sessions for the sheriffs, and we're going to cover, as many of them as we can, and we're going to do it online on Microsoft Teams, and we're going to allow these people to do it while they're at work, so that it's not, viewed as infringing on their personal time. So making that good information available was another huge strategy. I think we've all witnessed that, the sheer volume of information out there is staggering. It's absolutely staggering, and not all of it is good information. So, having the foundation to work from, and then helping to distill out what of that information was good information, those were our 2 big prongs that we worked with.
And I appreciate that last thought as well. I think that, we're in a world where there's a lot of poor information out there that can be harmful, and helping to direct people to quality information like the CDC website, although it can be overwhelming for your average person. It has a lot of richness there in many languages, and with some awareness of some of the cultural differences that exist as well. I'm wondering if I could have you all comment on this so-called hybridized workplace, in which some workers are vaccinated and some of your workers are not. What should managers do to ensure the safety of all workers if you're in a situation like that, where not everybody on your team is vaccinated? What's the best approach that you can recommend for now?
Well, maybe I'll chime in, since we're working on guidance right now to try to address that this is challenging. And, in some ways, maybe it was easier to go into, full lockdown mode like we did last spring, and coming out of it and bringing people back to work is really challenging. And, even though we have great vaccination numbers and more people are getting vaccinated every day, the reality is that very few workforces are going to be fully vaccinated right now. We're not there yet. And so we do have to account for that. Really, at this point, we have to acknowledge and protect the unvaccinated workers. So all of the mitigation strategies that we have recommended throughout this response apply. Things like physical distancing and mask wear for people who are unvaccinated, ventilation, physical barriers, the hand hygiene, all of those controls are still in play. Where it gets complicated, and I think some employers may be uncomfortable, is talking and addressing and inquiring about vaccination status. And that's, many people view that as personal information, medical information that they may be hesitant to want to provide, and employers may be hesitant to ask about. But the EEOC has weighed in and says that you can ask an employee's vaccination status. You can, and we have not really, we don't go one way or the other in saying that you have to require proof. You can also follow the honor system. It's really, up to the employer to decide if they want to ask about vaccination status, if they want to have proof, or if they just want to take people for their honor system. But then you have to address the people who are fully vaccinated. And if you decide to ask and go forward with asking vaccination status, or going the honor system, then we still recommend that it's okay for vaccinated workers not to wear a mask and not to social distance, but recognizing that can be complicated to enforce. And so I think every employer is going to have to sit down and work on their COVID response plan, make decisions. I would hope that they're including employee representatives and HR and labor representatives if you have a union, to come up with some thoughtful plans so that this can be implemented in a way that people are comfortable. But the real issue is that once you ask the vaccination question, you can't go any further. You can't ask why, because then you start crossing into HIPAA violations and issues around ADA. And so that's where I think people get uncomfortable and just don't want to ask the question. And then if you do ask the question, you have to have a plan for where you store the data, because that is medical information. So it is tricky, and employers are going to have to sit down and really think through, what's going to work best for them in their environment.
Thanks for that. I know for the University of Colorado, where I work, we've been instructed as managers that we can ask if someone's vaccinated or not. We can also ask the date of their last vaccine, their last shot, for purposes of planning return to office as well. But to stop there, and we're reminded to tell people that they have the choice to answer or not answer. Chief, how's that working for your organization? And I want to come back to my earlier question about how are you all handling working with the public, where you don't know who's vaccinated and who's not?
So Lee, thank you. Again, this was an area that we acted early. We asked for legal guidance. We saw what the state of New Mexico did with regards to state police, and they had a mandate. We also saw what happened in California, where because of what Lisa spoke of earlier, that this is emergency use authorization, that they felt that would not hold up. So without getting into the minutia, we made the conscious decision to strongly encourage folks and to support folks in access, familiar faces, familiar voices in order to do this. And then again, we utilized signage as well here that promotes a healthy workplace and people getting vaccinated. As far as interacting with folks in the community, we utilize the CDC guidelines that our officers who are vaccinated, and if they go into the hospital setting or a jail setting, public transportation, all officers are required to wear the masks and to use that type of guidance and judgment in large crowds as well. And any of our officers that have not been vaccinated, or civilian staff as well, that they are required to wear masks while at work.
Dr. Koval, go ahead. I know you want to add
Sure.
to that.
I know just last week, Denver Health updated their own internal guidance after it was clear where the CDC was headed on this. And in the healthcare setting, I think the big distinction that's been made is clinical areas versus non-clinical areas. Areas where you're concerned about the vulnerability not only of patients but unvaccinated workers, as Dr. Delaney mentioned earlier, are kind of two different questions. So, very similar to what Chief Payson just said, by and large, if you're working in a clinical area, you're masked at all times. However, if you're in, the cafeteria, or if you're in a public place, or you're outdoors on the campus, then the vaccinated folks, of course, are permitted to go unmasked, whereas the unvaccinated employees are expected to stay masked at all times. I think this is proving in real life to be very challenging for managers, because I think there's still a lot of managers that are uncomfortable asking the question, no one feels comfortable, I think I can safely say, asking for the proof, like you mentioned. I think it's going to take a little more culture shift before that ever happens, if it ever happens. Having said that, I know our vaccination rate very early on was above 90%. It's still not 100% because we have definitely still had some employees fall ill since then. But, you know, I think we're in as good a shape as we could be right now, given the guidance that we have and making the best of it.
So extending this a little further, we have a question in the chat. The question is, we have a fitness center for employee use. In regards to EEOC, is there a problem allowing those who have been vaccinated to fully use the facility unrestricted while having restrictions for those who were not vaccinated, or would that appear punitive? What do you all think?
This is usually where I say you need to consult your legal counsel. This is about as comfortable as I'm willing to go on these, you know, but I think that the question though is really an important one, that this does bring about a lot of conversations related to will people be targeted or in the workplace because they're wearing a mask? Oh, that's the person who hasn't been vaccinated, and will they be isolated? And so that, I think, you know, this is part of like a greater question of how we're going to view people, you know, the vaccinated versus the unvaccinated, and how we deal with it. But I think whenever you have these types of questions, I would always recommend talking to your legal counsel to really further flesh that out.
Yeah, but you know, as public health people, you know, I feel to some extent like by defaulting to the legal argument, we're giving away something that we need to hang on to, which is what's the best thing in the best interest for the largest number of people that we're trying to keep safe, right? And I'm actually reminded there's an editorial or a commentary in the New England Journal this week talking about legal epidemiology and the lack of research that we have about how legal decisions and regulations impact public health. You know, so it's, you know, we're relying on legal opinion, which may or may not end up being the right thing for public health. So I agree with you. It's unresolved, and we're going to default there, but it's an uncomfortable place to be as public health people.
It surely is, Lee. I completely agree with you. And I know, you know, I know what our organization has tried to do in these situations, and not always perfectly, is resort to as factual a conversation as we possibly can and talk about the risks and talk about the benefits with as much data to support what we're talking about as possible. Looking at, you know, what is the experience of other gyms in the community? What evidence do we have that, you know, using the same treadmill as someone else, you know, could be a source of infection? You know, that data is not necessarily plentiful, but there is a little bit of it out there. But I think when we try to remove as much of the stigma of it as possible and keep the conversation as fact-based as possible, that's generally proved more fruitful for us than it has otherwise. But it's not an easy thing to do.
Yeah. Well, and Captain Delaney, hasn't some of the messaging that's come out really been around, now that you're vaccinated, you have certain liberties that other people don't? I mean, aren't we already kind of manipulating the conversation to communicate that there's a certain set of freedoms that come with getting vaccinated?
Yeah, and I'm reminded of one of my last slides, with the green mask for everyone who's been vaccinated. You know, green means go. You can do all of these things, and then we sort of have a color-coded risk stratification for other activities, based on like the doctor mentioned some of the science that we have behind certain activities, with gyms being possibly on the higher risk because you have people, you know, breathing heavily and maybe generating more aerosols if they're infected. But
so I'd like to ask you all to opine into the future. And I know this is a risky part, but if you can look 6 months ahead, what should those of us who are frontline managers of any organization, especially frontline workers, what should we be concerned about in the next 6 months? What do you see in your crystal ball?
Lee, I'll jump in. You know, there's a lot of talk about a booster shot, and I think some of the areas where we've seen some success with the participation in the initial vaccination is that we look to build upon those. And, you know, we talk about that this comes from a trusted voice or a trusted face, that we make access easy. You know, there's also incentives that can be done. We have a wellness and resiliency program that has points, and there's things that you can incentivize based on those points. And historically, we've used those points for flu vaccinations. We can do the same and just project out that there's talk of boosters for Pfizer and Moderna, and that we are thinking, like you say, Lee, 6 months in advance of, okay, how can we see what worked? How can we improve upon areas that maybe need a little bit more assistance, and then try to be ready for a potential booster.
That's great. I'll jump in next, and I'll echo a bit what Chief Payson has said. I think the good news is we have a lot of mechanisms in place that we can reactivate at any time if we need to. So if we need to give boosters, you know, we know how to do that. We know how to go to where the people are and give it to them. I guess the other thing that pops into my mind is, you know, from a public health perspective, I know I'm watching that percentage vaccinated number like a hawk, because I look at that unvaccinated pool of people and I think, well, is that still big enough? Are there still enough infectable humans, you know, for these dangerous variants to arise? And you know, we know this virus mutates all the time. We know that happens all the time, and most of those, you know, are not dangerous. But I want to see that number go down and down and down. And so, as far as encouraging the unvaccinated, and not in a punitive way, like we mentioned earlier, and not in a shaming way, but an encouraging way, you know, just to continue to have that conversation as often as we need to get that number as small as possible. That's what's on my mind.
Yeah, I concur with everything that's been said. I think, you know, we need to continue to promote and encourage vaccination, and so that's really what I see. You know, there's a spectrum of people, and I think that there's opportunity to continue to get people who are on the fence over to the side of getting vaccinated, and that's really going to help get us to, you know, a point where we can all feel really safe and be fully back to normal.
I'm wondering if any of you have a quick comment about, in particular, the communication strategies with some of the, among our most vulnerable workers, who are proportionally less likely right now to be vaccinated, including the Latino, Latina, and people of color. What are some of the communication messages? What are the strategies that we need to use? Are they different than what we're already doing to try to boost their engagement in vaccination?
Yeah, I mean, I think this community engagement, there's such a huge effort at CDC. One of the priorities of the vaccine administration was to try to do it with, you know, an equitable fashion. And the obstacles in some of these communities, it's not that they don't want the vaccine, it's that they don't have transportation. They're fearful of it may impact their immigration status. There's a lot of topics that I think we can do. You know, we have to reach out to those communities, work with their trusted groups, whether it's, you know, advocacy groups or local associations. I mean, I still believe that workplaces are an important role, and employers can play an important role in that. To continue having those conversations. I mean, it's not a one conversation, oh, you don't want to get vaccinated, let's move on. You know, it's an ongoing dialogue, and engaging, you know, really the frontline community members in those conversations, and making it as easy as possible. The 9 out of 10 people in the US are within 5 miles of a vaccine site. So we're getting there. You know, the model of the mass vaccination clinics are going away, and vaccines are going to be offered through primary care physicians and retail pharmacy. So, you know, hopefully the access is also, we'll be able to overcome some of the access issues as well.
Yeah.
Thank you for those thoughts. Yeah, go ahead.
No, I agree with what Dr. Delaney said about kind of moving from the mass messaging to the one-on-one messaging. That seems to be a trend, at least for sure from the healthcare perspective. Mm-hmm.
It's a big lift, but it seems that people have the need for that kind of engagement, and so I'm grateful for that. We do have just a minute or two left. We do have a question in the chat which is being responded to right now, but one that is out here. What can and cannot be tracked for employee vaccine status? And I think we already know you can track whether people say yes or no, and I think you can also say, without me being a lawyer, you can ask when they received their vaccination. But is there other information that can be tracked? Regarding employees, I think most people are drawing the line right around there. I'm not sure what else people would be gathering. Certainly on a manager side of things, you know, we're probably not going to go there. Sort of related to that, it triggers for me, and Captain Delaney maybe know the answer to this. And I know it's not your department, but it seems at this point that OSHA is deferring to CDC guidance. Do you have any comments about what you know about what we may or may not hear from OSHA, and should for now we just keep working with what CDC is sharing?
Yeah, I mean, I can't speak to OSHA's current posture, but you know, there was an executive order that asked them to take a look at whether or not an emergency temporary standard was needed, and so they've been having those discussions internally. And as our role at NIOSH, we provide them with technical scientific information to help them in their deliberations. So that's really where they're at right now. They did issue guidance and updated guidance in January. It's probably outdated with like ours based on the new recommendations, but that is available, and so I encourage you to go to their website to get that information.
Great. Well, we're just about out of time for today. I'm wondering if any of you have parting words of wisdom for our group here today. If there's one thing that you could tell someone today who's managing an organization, what's the one thing that you want us to walk away with? Let me start with you, Chief.
I'll just reiterate a couple of what we've talked about earlier: to act early, to communicate clearly, to have information shared on a regular basis, and work in a collaborative way to get as much information out to your workforces as quickly as possible from trusted sources.
Thank you. Dr. Koval, last word?
Absolutely. I'm very optimistic about where we've gotten to in the last several months. But I do think that what we do now determines where we're going to be by the end of the year. And we're sort of coming to the edge of the woods, but we're not quite out of the woods yet. So I do think we still do need to remain vigilant about spreading the virus.
And Captain Delaney?
I think we're not out of the woods, and we've just got a little more ways to go. So let's not let our guard down. You know, we're heading into Memorial Day weekend, and you know, more people are getting vaccinated, but we're not there yet. And so just hang with us. Please be patient. Wear your masks. Get vaccinated, and we're going to see better days soon.
Thank you for that note of optimism. I really appreciate that. And I think we're all starting to feel that way. We're seeing that light at the end of the tunnel. Courtney, I'm going to turn it back to you, but let me conclude by thanking all of our speakers. And there is at the end of this Zoom going to be a survey. So please give us feedback. We really appreciate that. And thank you to all the speakers for joining us today. Courtney, back over to you.
Ms. Lee and all of our speakers, and to everybody who attended today. We're just gonna close out and turn this off. But before I do, I will share my screen one more time and let you all know that we do have another webinar focusing on returning to work for small employers next week, a safer return. And you'll receive information in the follow-up email. We hope to see you again next week. Thanks, and have a great day.
Great. Thank you again all. Take care, be well, stay safe.